Hello, everyone, and thank you for listening to IFFGD's COVID-19 program. The information and resources shared during this podcast should not replace any medical care you are currently receiving. It's important to always consult with your doctor or other healthcare providers before making decisions about your treatment. So today we have the pleasure of speaking with Dr. Van Tilburg, who is Associate Professor of Medicine, Social Work, and Clinical Research. And then we're also speaking with Dr. Simon Knowles, who is a Senior Lecturer at Swinburne University in Melbourne, Australia. So thank you both for joining us today. Can you both briefly explain your areas of focus in research and kind of sort of what you do?
Absolutely. I'm Dr. Van Tilburg, and my area of interest has been functional abdominal pain in children as well as irritable bowel syndrome in adults, but also have ventured in a lot of other GI disorders.
And Dr. Knowles, what's your area of research focus and also kind of what you do day to day?
So, day to day, I'm an academic, but I'm also a researcher and a clinician. I specifically work in gastrointestinal conditions, and like Miranda, my research really overlaps with a number of different gastrointestinal conditions. But predominantly, one of the things that I'm really fascinated by is the interaction between psychosocial processes and how they can ameliorate the impact of living with gastrointestinal conditions. And once understanding those, what I do is I look at trying to target them through online interventions, whether it be for gastroparesis, irritable bowel syndrome, inflammatory bowel disease, and celiac disease and other basic GI conditions.
Awesome. Thank you both for explaining that. I think you're both doing awesome work in the GI field, and we greatly appreciate that. So, as we continue to face the daily impacts of COVID-19, we have also seen that this pandemic can have a major impact on the symptoms as well as the well being of those living with gastrointestinal disorders. And actually, today, we're going to speak with Dr. Van Tilburg and Dr. Knowles and to just better understand some of the steps that researchers are taking to better understand the impact of coronavirus or COVID-19 pandemic for those living with gastrointestinal conditions. So, since COVID-19 has dramatically changed our lives day to day, what are some of the current impacts of COVID-19 that you both have seen from patients living with gastrointestinal disorders? Dr. Knowles, would you like to start?
Yeah, I'm happy to. I mean, when we think about the COVID pandemic, we need to understand that there's uncertainty that's playing out and a change in our routines. There's increased isolation that is playing out, whether it be in Australia in terms of people now being isolating or in US or around the world. And we know that when we think about the pandemic, it's a stressor. And when we think about gastrointestinal conditions, we know that individuals who experience stress are more likely to experience an exacerbation of their gastrointestinal condition, and that exacerbation of stress is going to lead to poorer quality of life, and in some cases more difficulty in terms of managing their condition. So, reminding themselves to take their medications, to continue on a diet, etc., that they might need to do. There's also fears around the potential susceptibility to being infected with COVID. For some individuals living with a gastrointestinal condition might mean that there are medications like immunosuppressants, like if they have inflammatory bowel disease, which mean they might be more at risk. And so there are obviously concerns about not only living with a gastrointestinal condition and the complexity that involves in their life, but then adding in this whole nother layer, which is the pandemic. So there are a lot of fears and concerns, and in Australia, one of the things that we saw immediately, when the pandemic occurred, was a massive buyout of things like sanitizer, of toilet roll paper. Now, for many individuals living with gastrointestinal condition, having access to toilet paper is really important, and so there was increased anxiety around that, and of course, living in the current pandemic has also changed the way in which people interact. This includes the way patients interact with psychologists like myself, but also with their specialists like gastroenterologists, their other doctors. There's more telehealth, and so again, that can bring its own complexity. Yeah, and we can also mention things like getting access to medications, getting access to food. In Australia, there was a buy-up of a lot of food, and so for people who are on specific diets, like a gluten-free diet, it meant access to some of those foods was more problematic. So we can see that not only is the COVID pandemic having an impact upon every individual in society, but I think when we think about individuals living with a gastrointestinal condition, there are particular challenges that they face, not only living with their condition, but also as a consequence of the COVID pandemic.
Yes, yes, I agree. And Dr. Van Tilburg, would you like to touch on some other things too that you believe some patients also face while facing the current impacts of COVID-19?
Well, I think that Dr. Knowles touched upon the most important parts. I mean, it's stressful to be home, and especially if you are a parent and you need to work and also school your children. That's been specifically very stressful. Add in having a disease yourself or your child having a disorder, that becomes all the more stressful. And then, of course, the access to food, the lack of access to medical care during lockdowns, etc. So yeah, I just completely agree with Dr. Knowles that all of this has been really difficult for people with gastrointestinal disorders. That doesn't mean that everybody is super stressed out about it. Some people are doing really, really well. And it all depends on each person and what situation you are in. I know in the United States, lots of people have lost their jobs, for example, or cut downs in hours. And all those things add up, depending on where you are and what happened with your job and what happened with your life circumstances and with your community, how much lockdowns there were, etc. Depends on how everybody's situation is and how they react to it.
Yeah, yeah. And I think both of you actually touched on some really good points there, and that I think patients definitely can relate to as far as the impacts that they're facing right now. Dr. Van Tilburg and Dr. Knowles, can you share what you previously know about the interrelationship between psychology and the gastrointestinal well-being?
Well, we know that the brain and the gut are connected, and I think the eye patients specifically are already very aware of this, but I think pretty much anybody is aware of this. You just think about butterflies that you feel in your stomach when you're in love, for example. It's such a common reaction, or to feel nauseated when you have to have a really difficult talk somewhere, or have to go run to the bathroom before a game. It's just the brain and the gut are so interlinked. We call it your gut the second brain for the reason that it's not only driven by the brain in your head, but it has its own nervous system that can operate sort of independently sometimes. And if you want to move your hands, you have your brain has to say move your hands, but your gut can sort of do its own thing. However, that also makes this interaction between the brain and the gut really interesting. And so not only can stress or things like that influence your gut then can influence how you think and feel and behave in certain ways. So it's a really complex, very interesting relationship. But for patients, that means that if you don't feel well in your gut, you will have think about that, feel things about that, but also if you have certain feelings, it will affect your gut. So it's really bi-directional.
Yeah, yeah, I agree. And Dr. Knowles, would you also like to touch on that a little bit?
Well, I think what Miranda's saying is exactly right. We know that there is a very strong link between the brain and the gut, and no doubt the listeners have their own experience of how that plays out for them. And that's one of the things that Miranda and I and researchers working in this area are really fascinated by, is how does that actually work? And by us understanding that, how can we develop more effective interventions to help individuals who are living with gastrointestinal conditions?
Right, right. Yes. And I think that is two very good points and insights on how basically the relationship between both of these things and the current impacts and the fears that many patients are relating to right now during this pandemic. So also you either can both of you actually share with us what kind of led you all to start this study, which is a study that is researching how COVID-19 and this current pandemic impacts patients who suffer from gastrointestinal disorders. We just kind of want to know what led you to want to start this study.
Well, I'm the lead of the project, and we're very lucky to have around 19 leading experts around the world being involved and developing this study. It really started with, the experience of the pandemic here in Australia, and noticing things such as the impact of the COVID pandemic is having on my own patients in terms of their psychological well-being, the impact of having to interact with their specialists in a different way, and the challenges around potentially attaining medications and getting access to resources that they need in everyday life. Things like gluten-free food or other, maybe FODMAPs-based food, or access to medications. And so, and this was, one of the things is that the group that we work with, this sort of psychogastroenterology group, are really well connected throughout the world, and we have an interactive, often email conversations that go on. And this was part of the discussions: how do we work best to understand what the impact is on COVID on our patients, and how can we help them now, but also in the future? And so, as a result, this project came out, and it touches on something what Miranda said a little bit earlier, which is it is really interesting that while there are some individuals who are finding it more difficult to manage living with a gastrointestinal condition during times of the pandemic, there are also people who are adapting very well. And so this research is about trying to understand what the impact is, whether it be both practical in terms of getting access to resources, but also impact upon their psychological and gastrointestinal well-being. What are the factors that might ameliorate that? So how people perceive their illness, how people perceive how they can cope, what resources they have in terms of social support, and again, how that might help us understand what makes people better able to manage living with a gastrointestinal condition during a time of significant stress. And that's one of the things that the project's really trying to understand. By helping us participate, it will give us important information about that, so that not only can we distribute that in terms of how we work with our patients, but also more generally, through things like online resources.
Mm-hmm. Yeah. Yeah. So basically, it's doctors around the world just kind of working together to best understand how they can help the patients and what they need and what they need, especially during times of significant stress. I think that's a great point that you touched on
Yeah.
there.
And I think I'd take it another step in saying that it's really a collaboration between not only the researchers, but also those living with gastrointestinal conditions. We can only learn from those people who are living with their experiences of having a gastrointestinal condition, and they have, this wonderful knowledge that can really help us better understand what they're going through, and in turn be able to help not only other people, but also people in the future who are living with or who will live with a gastrointestinal condition.
Yeah, yeah. And so can you both or Dr. Van Tilburg, if you would like to start just kind of explaining just a little bit more about the purpose of this study and what you all hope to find in the outcomes of it.
Yeah, so with the study, we're really focusing on how people are adapting to COVID-19 and the lockdowns around it, and everything that's happening around us currently, and how that affects them as patients, specifically GI patients. So we're looking at how it affects their symptoms. We're looking at what kind of fears they might have, or what kind of worries they might have, how they're coping, etc. And our hope is that over time we see changes in people as they're adapting, or maybe as they're getting more stressed out, and to sort of see what kind of factors predict good outcomes, what kind of factors predict maybe people not doing as well. So again, as Dr. Knowles said, that will give us information for the future to say, let's intervene in this way, or let's give these resources to people of these kind of things that can help them. We're really in a very unique situation with this pandemic. I mean, we talk about stress all the time in GI disease. We know it affects the gut, but this is such a unique situation. And who's lived through a pandemic before? I certainly have not, in not something this big, right? And so I also think we barely have even scratched the surface of what that means for most of us, and not just GI patients, but I think everybody in our whole society. Currently, we're so focused on the virus and containing the virus and how we can contain not infecting more people and people not dying. But these, by doing these things, it has really tremendous, profound effects on us as a society, on children, for example, their learning opportunities, their socializations. Like think about if you had an 8-month-old, and they're going to grow up and get older and not be socialized to other children their age, so an age where they start to sort of be interested in that. So there's all of these little things that could affect somebody potentially lifelong that we don't really know what's going to happen. And I think it's really important for us to realize that it's, although currently focused on containing the virus and making sure that people aren't dying is really, really important, we also really need to take into account how is this affecting people, how is it affecting them long term, and what can we learn right now that we can apply if this ever would happen in the future again, right? So we could say, these are really important aspects. These are really important things for us to pay attention to early on in a pandemic so that we don't make the same mistakes if we're making mistakes, but we probably do. We all do when something new like this happens, right? The experts don't know exactly what's going to happen, how it's happened. There's just as much uncertainty for the experts as there is for regular people on the street. So I think it's a really big learning opportunity for us to figure out exactly what's going on, how patients are doing, how is it affecting them, etc.
Yeah, and I think it's so great to see just a group of doctors teaming up together to really take everything into consideration that we can right now, while we have the time to really focus on how doctors can best help the patients in that community, and especially those suffering from gastrointestinal disorders. I think that's great that you shed light on that also. Um, and can you or Dr. Knowles, can you explain to us kind of sort of what patients might expect while taking part in this study?
Yes, certainly. So people can participate going to the website GI study, GICovid19study.com, and no doubt you'll have the link for individuals who are welcome to participate. What we're doing is we're looking for any individual that is living with a gastrointestinal condition to participate. So it's not directed to a specific gastrointestinal condition, so any and all are welcome. To take part. It's an online study. It takes approximately 30 to 40 minutes to complete, and there are multiple time points. So we've got a time point now, and we'll look to do a time point approximately 6 to 12 months later, as a way to again look at change across time, and that's one of the things that is really going to be a powerful aspect of this study, is not looking at just only at one point in time, but how it affects over time. Yes.
Yeah, no, I think that's great. And that's a good way to kind of look at not just what's happening today and what's happening now, but also just looking at the overall time of all of this. So, Dr. Van Tilburg, can you share with us a little bit what the study's findings will help us with in the future for patients living with gastrointestinal disorders?
Well, hopefully we will find how we can help people, improve their quality of life, reduce their stress, and sort of make sure that their symptoms don't increase too much during a time of pandemic. Although, of course, there's biological aspects to that as well. But we're hoping to find factors that we can say, well, if this happens again, or if this continues, that we can give tools to people to help them so that they would increase their quality of life, at least not decrease it as much, or even in times of stress, that their symptoms won't go through the roof, for example. So yeah, those are our main hopeful findings. Of course, you never know. That's why we're doing a research study. If we already knew what we needed to do and how to do it, then we would do it currently. And certainly lots of people are giving advice currently, and you can go and get advice from your doctor. And if you work with a psychologist, you get advice there. You work with a dietitian, you get advice there. We know a lot that we can do, but this is really unique situations. Can we do anything more in this type of situation? That's what we're trying to find out.
Yeah, and Dr. Knowles, would you also like to kind of touch on what you hope to also find out of this study?
Yeah, I mean, I would concur with Miranda about, looking at what's helpful. I think the other thing too is that hopefully we won't see a pandemic like we see now for at least 100 years. But nonetheless, it's also translatable. So how people are dealing with the current stressor can also give us an understanding of how they might deal with stresses not as significant as a pandemic. So we can still translate the information that we get now, the learning, to everyday life stresses and how people manage that. I'm also hoping that not only do we have a better understanding of what are the factors and what we can target in terms of interventions to help individuals, but also as a way to help gain knowledge and to advocate in terms of the impact of COVID on individuals living with gastrointestinal conditions, so that we can make the general public more informed about what it's like to live with a gastrointestinal condition, what it means on an everyday basis, and how stress plays a role, and how in this case the pandemic is playing a role. So not only do we hope that there's going to be practical outcomes for those living with gastrointestinal conditions, but we also can use the information we get to also better advocate towards the general public about getting them to understand, the impact of living with gastrointestinal conditions.
Yes, yes, and I would definitely agree with both points there of the findings, and hoping that honestly, I think just what I gained from both of you, what you hope to find is just that that we have more knowledge, and we can better educate the general public of what it is like to simply live with a gastrointestinal disorder daily, not just whenever it's stressors or anything like that, but just what it's like to live with these disorders day to day. And I can't wait to hear. I know the patients also cannot wait to hear more about this study and what you guys are finding. I think it's a great thing that all of the researchers are doing in collaboration to come together to really help the patient community. Is there any other advice that either of you would like to give the patients at this time?
I would say this is a great area to advocate for yourself as well. Just I'm thinking about all these people who don't have access to all kinds of things that they need. I know that, for example, the grocery stores in the United States have installed an early hour where senior people can come and shop, so that they have their first pick. It's not all gone, and we might need something like that also for people who live with GI conditions or other conditions that have food restrictions and really cannot eat anything that's left over on the shelves. And that can translate into other situations as well. For example, we have hurricanes or things like that, when food just disappears really quickly, and it makes it really challenging for people with GI conditions. So I think as we are all sort of adjusting to this new situation and the new things that are happening, it's really important for the patients themselves to speak out as well, to teach others around them that it's that they have needs that need to be met. What are we going to do when lots of shops are, for example, opening, but the restaurants remain closed because of infection risks? That really limits a lot of GI patients of going outside of their house and potentially getting things that they need, for example. So I know patients are doing this all the time already, but this is sort of a really great time to tell people, as we are adjusting to the new situation, and when maybe we're going back to a sort of new normal, this new normal needs to include the things that we as patients need for this type of disease. And I know that IFFGD plays a really big role in that advocacy as well. And we're just really happy for you to always be there to be a voice for the patients.
Oh, thank you. That was very nice. Thank you so much. And I think that both of you guys have touched on some really good points. And like I said before, I know that we are all excited to hear more about some of the outcomes from this study. Thank you, everyone, for tuning in today for the IFFGD's COVID-19 program. And of course, many, many thanks to Dr. Van Tilburg and Dr. Knowles for speaking with us today about the impacts of COVID-19 for those living with gastrointestinal disorders. We are very grateful for you all for sharing your unique insights with us and on this topic. And as always, we wish you both the absolute best and luck as you continue to conduct more research in this area.
Thank you, and thank you to the listeners for listening to the cast. And I look forward to, well, Miranda and I look forward to talking through the results in the future. Thank you.
Thank you all.